everyone. Let's talk about referrals and what happens to them. It is really about the way we involve others in the care of our patients in the emergency department. These things include consults, admissions, referrals of different types. This video is intended for both docs and clerks, health unit clerks, because they include referral management. In the demos, I'll separate both so you know where to go. Let's get started. Involving consultant services. We do a lot of handover of care in the ED. These are orders. There are of many types, and we're going to go through them. And then we're going to talk about how they are managed by the clerical staff. The new referral management system that manages most of these. I promise you that after some growing pains, actually life will be much better with the new system. Here's the way we involve others in the care of our patients in the emergency department. We either ask for consultations. This is when the patient is in the emergency department, has not left, is being seen in the emergency department. That's called a consultation. We can admit patients directly. Doesn't usually happen, but sometimes it does. And these are called PAOs, patient admission orders. The third way we do it is through referrals. And referrals mean external referrals outside this visit into the emergency department, be it to other hospital or community resources. Consultations are pretty easy. You order it and you communicate in person. You can call them directly or the nurse or the clerk can get them for you, but this is basically it. Order, communicate, done. How about admissions? So admissions are ordered, but they do fall into two categories. One is for inpatients. So we put the PAO in and the bed starts being assigned by bed management. The general idea is for inpatients is that the PAO is put in by the consulting service. However, there will be situations where you might need to do that. In doing interim admission orders, for example, for oncology the way in St. Catherine's, or sometimes if you're referring to ICU, so the patient's intubated, and ICU would say, you know what, just send them upstairs, I'll take care of them. They cannot move upstairs unless there's a PAO, so that the patient turns into an inpatient, everything flows into the inpatient chart, and bed assignment begins. Another place where we use this, it would be surgical patients being admitted directly from Welland to surgery in Niagara Falls. You would also need a PAO and transfer orders or interim admission orders. However, PAOs are also used for a special population of patients, which we are calling outpatient in a bed. These are patients who are going to the floor, but they're not going as an admission. The two biggest examples are pediatric CDU and GIMRAC, and there are a couple of others. What happens here is you order the outpatient in a bed, it's still a PAO, and then the patient is transferred to the unit without actually being admitted to the hospital as an inpatient. How about referrals? Well, there are several types of referrals. We have separated PARC, or the Pediatric Assessment Clinic, from the other internal clinics only because it was not included in the referral management to start, so we had to do a workaround, which I am sorry actually complicates lives for the clerks, but as soon as possible we're going to bring these back into our internal outpatient clinics so they're managed through referral management instead of being managed through the scheduling book. The other groups we send referrals to are internal clinics, and of course there's the external outpatient clinics, which are private practices. If you're doing a PARC, you're going to order it. It's going to be scheduled by the health unit clerk, and then the patient will be informed in the ED of their appointment. Internal clinics, they are of two types. There are ones where we directly schedule. The two big ones are ORHTO and St. Catherine's GIMRAC. Welland GIMRAC is coming online as well. Plastics is coming online as well, so they'll be scheduled before they leave. I am not sure if we're going to be able to get Plastics online day one. If we can, we will. If not, it'll follow in short succession. But this follows the same trajectory. You order it, get scheduled, the patient's notified of their appointment. There are other clinics in the hospital where we do not schedule directly, like Thrombo, like LDAP, etc. These are ordered. While they still go to order management system, they are processed by the health unit clerk and they are forwarded to that clinic to be booked completely electronically. There's no paper, and that clinic will contact the patient. The info for that referral will be included automatically in the patient printout when they're being discharged. The last is external clinic, and this is ordered and then sent by the health unit clerk through referral management. It sends it directly if they're connected. If they have the fax number in the back end already in the system, they get faxed automatically from the system. On the rare occasion where there is no fax number, you can print them and fax them, On the extremely rare occasion where the clinic is not in the system, for example, it's out of province, out of city, something special, you can still use ER docs if they have their own referral, or you can just print it from here, attach it to a consultation, and then fax it manually the good old-fashioned way. The clerk would then put it in the chartlet for the patient so they get scanned and entered into the record. Let's talk about consultations. While you can, anywhere you can search for orders, search for consultations. So here I've started consult for general medicine, and there's general medicine, general surgery, and gastroenterology is pretty close. I want you to get used to using ED quick orders. We have put in all the consults that we think you will need. Some we use way more than others, but they should be here. Click them down, open the menu, and you can pick one of those. So, consult to general internal medicine. I'm going to fill in priority, turn never routine from the emergency department, who is the consulting physician. You can't consult a service without a specific physician. However, adding the physician's name does identify them in the system and to the clerk to know who they're calling. But more importantly, it automatically adds that patient to that physician's list so that when they manage their list and they look, the patient once referred is already there. So you don't have to spell a difficult last name. The patient's already there in their list. Special instructions. The special instructions go to the clerk. The consult reads in here, goes to the consultant and shows up on their list. Here's a sample. So I've consulted general internal medicine, specifically Dr. Lorraine Jensen, for a priority of urgent. The reason I'm consulting is the patient has a PE and a PESI score of 115. And what I've done here is I've told the clerk, I have called Dr. Jensen. You don't need to call them. I've already placed the call. They can document that in their system and move on. Now, what happens on the clerk's end? Once I've put in this consult, the consult shows up in the patient under the clerk's task. This is the clerk's view. And if you hover on their 3 tasks, they know that they have 3 tasks to do. One of them is a consult to general internal medicine. When they click on this, that's the view they get. And here is the patient care consult. They'll hit document. This window opens. The clerk puts in date and time of the attempt, if they called back, any instructions, any notes called by Dr. Setrak. Click the check mark so you can sign it. If the consultant does not answer, click the save so you can come back and document second attempt or third attempt. Because if you sign it, it disappears from the list because it's considered done and over with. Remember this? We spoke about consultations. Now let's talk about patient admission orders. Patient admission order, as an order, you can search for it wherever you can search for orders. Once you find it, this is what it looks like. There is multiple options. In Emerge, we're only interested in the first 2, which is admit to inpatient or an outpatient in a bed. Let's take a look at admit to inpatient. Pretty straightforward. Multiple fields. You're going to fill in the required fields, which are in yellow. Now, this is an important field I want you to pay attention to. Generally, it would default or you would use yes, move to a different bed than current, right? So that admitting knows they need to start looking for a bed for this patient. The third choice is very important for us because it indicates that the admitting needs to look for a bed for this patient in a different site. And this is especially important if you're admitting surgical patients from Welland straight to the surgical floor at G&G. Here's an example of a completed order. I intubated a patient, spoke to Ben Tam in ICU. He said, you know what, I'm busy. Just put in a PAO and send the patient up. So I said, under general internal medicine, it's the intensive care unit level of care. Ben Tam, this is the site. Move them to another bed. And I put in some instructions here for the staff. Transfer to ICU. Dr. Tam will meet the patient. And there, do a CT head on the way up so that they know what I want to do. Outpatient in a bed is a new concept. This includes, as you see here, levels of care are either GYNAC or the obstetrical ward if you're sending them to delivery, pediatric ward for pediatric CDU, and postpartum patients in the first 2 weeks, they're supposed to go directly there. Notwithstanding the struggles of access, at least, but this is the process. What happens when I complete this? Medical service, they're either obstetrics or pediatrics. Request bed assignment. If you choose move to another site, say for example, you are in Niagara Falls and the patient's going to CDU in St. Catharines, you choose move to another site and indicate the site as St. Catharines. That will tell admitting that they need to talk to the guys in St. Catharines. Okay, so we did consultations, we did PAOs. Let's talk about referrals. 3 categories, we'll take them one by one. We'll start with PARC, and as I said, the only reason PARC is different now, it will eventually sit with orthoplastics and GIMRAC, is because it came in late to the game and we couldn't change the system, so we did a workaround, and I apologize to the unit clerks. We had no power over this, but as soon as we can, we will bring this into internal medicine. For every one of these, there's a tip sheet. The tip sheets they have a standard structure. There's about the first page or 2 are instructions to the docs on how to put in the order, and then the rest of it is instructions to the clerks on how to book or send this consultation. And as I said, this is a workaround, but it'll so go back to referral management system. Ordering it. You're going to look for ED-PARC. It's come up here, ED-UCC, because PARC takes referrals also from UCCs. And there's also PCC, which is the Chronic Kids Clinic. We hardly ever refer to that, but it's also here. We're going to click on that. This is what it's going to look like. So for the regular PARC, you're going to do a communication order, ensure child PARC appointment prior to discharge, and this is the referral form. If you're doing PCC, you unselect those and you select this one instead, which is the PCC. We've completed that. Here is the order. Special instructions. Everything is filled. Urgent category. What happens when we sign that order goes to the clerk. First, the work clerk is not going to go to referral management, but it's going to open the scheduling book. So clerks are going to open the scheduling appointment book to schedule PARC. And then this, and this. I know, it's a lot. So the best way to do this is actually go download the tip sheet, jump to the video demo where Leslie is demonstrating how you do this, and follow her steps in the video while you're going through the tip sheet. That is the best way for you to learn how to do this. Back to here. We talked about PARC. Let's talk about internal outpatient clinics, especially the stuff that's going to be scheduled right from the emergency department. These are ORHTO, GIMRAC, and plastics, if not day one, hopefully very, very soon. Same thing, ordering it, you're going to look for a referral, right? And here is your referral order at the top. You notice that you have a few referral order sets here that you can use. EPAC is one of them. Now, from here, you're going to click your referral order. You're going to fill in those information. You're going to pick the service. I love that we have dermatology. Just love that. And then you're going to pick up, and then you're going to search for the provider you want to send. Note when you're searching for the provider, you have an option of either searching for a provider, so a doctor in person, or a practice. In all these cases, we'll actually be searching for practices or a clinic. It's the ortho fracture clinic in any site, it's the plastics clinic, it's the GIMRAC clinic. So we're not looking for an actual provider, we were looking for their clinic. And then we're going to fill out the referral type. You're going to fill out the service by date, which is when do you want them to get the service? Do you want them seen within 2 days, within 2 weeks, within 6 months? If it's urgent or not, and from emerge, it should be urgent. If it's not urgent, we should not be referring it. Somebody else should be doing that. And this is an example of an ortho referral I've completed. So this is a referral to orthopedic surgery. It is sent to orthopedic clinic in St. Catharines without a specified provider. The reason is a Colles fracture. I've already done a closed reduction. This is urgent. I want it seen before the 12th of the month, within the next week. And please book and give the appointment. You don't need to write that. This is instructions to the clerk. I just wanted to demonstrate that you can leave instructions to the clerk here. Another example, there you go. This is for plastic surgery. Again, the clinic in Niagara Falls, because I'm working in emergency Niagara Falls, or in Welland. No specific provider, whoever is the system, is available for a right closed boxer fracture, which I had splinted. I want them to be seen in a week. It's an urgent referral. Here's another example for GIMRAC. So this is a GIMRAC referral. I've requested the GIMRAC General Internal Medicine Rapid Assessment Clinic. They're being sent because of a left forearm cellulitis and abscess, secondary to IV drug use. I've already started them on amoxiclav and doxy. I've already drained the abscess. This is urgent. Please book them within the next week. Okay. Now, the second type of inpatient clinics are patients clinics that we don't book, but the clerk processes the request for referral in the referral center and forwards it to that clinic to book and call the patient. From our end as providers, it really is no different. we're going to look for a referral. We're going to fill the referral order. We're going to look for a practice. Here I'm sending somebody to thrombo. So I've searched for thrombo in practices. You notice I came up with 2. There is the private clinic of their thrombosis. That's not what I'm sending them. If that was where you wanted to send them, you would, but that would be an external referral. We're using this one. And here it is. Medical oncology, because there's no benign heme. They fall under oncology. The reason I'm sending them is a PE with a PESI score of 65. I've already started on apixaban. I'm asking for the thrombosis clinic. I want to see them within 3 weeks. It is an urgent referral. Now, no more other forms. That's it. This is the only referral form you need. Remember that you are creating your documents electronically, whether it's your note or a consult note or a quick note, and the clerk can attach those to your consultation and will if you have them done before the referral is being sent. If the referral gets sent after, that is fine. They are still in the system. They can be accessed by the clerk and the physician on the other side when they're booking or doing triage. Here's another example. I'm sending someone to LDAP, so 5mm lung mass on weight loss, smoker, no PE, urgent. I've sent them to lung diagnostic clinic. I want them seen within the next week or so. And here's the third example. This is stroke prevention. Same thing. It's a internal medicine clinic, stroke clinic in Niagara Falls. This is the rapid referral clinic. This patient had 2 episodes of TIA with aphasia. He's fully recovered. CTA done. There's a 60% carotid stenosis. I've started them on ASA and Plavix. I want them seen within the next 3 days, and this is urgent. Pretty straightforward. You will notice that we're doing a lot of rinse and repeat here. External outpatient clinics, same story. Referral order. Now I'm going to look for a provider because I'm going to refer to somebody, and here I'm just going to send a kidney stone to Dr. Dion. So when I look for her, she has 5 different practices. I got to pick which one I want. So I want to send her to her private clinic. I don't want to send this to the prostate diagnostic clinic. I don't want to send it to the urology clinics. I'm sending this to her clinic in the office. I'll pick that and I'll fill in the order. So this patient is being sent for 66mm non-infected right distal ureteric stone. I want her seen in the next couple of weeks. This is for Dr. Dion. It's urgent. I've already given them morphine, naproxen, and Flomax. Done. Here's another example. I'm sending this to Neil Malhotra in gastroenterology, gradually developing anemia over 3 months, intermittent bowel bleeds. I've held his ASA for a week and started him on Panto. Same story. It's an urgent referral. Rinse and repeat. I'm sending this new right-sided hernia that is reducible to Jeff Cranford. I haven't done any treatment. I want them seen within the next 3 or 4 weeks or a month or whatever. Here's another one. This is ENT. I'm sending this to Helen Caetano. This is a new onset sensory neural hearing loss. I don't know why the L is there. This patient, I want them seen in the next 24 hours. And I'm going to say it started with prednisone. And this is a referral that I would have definitely talked about to Helen. I've called her, told her this is what I have. I have a new sensory hearing loss on the left side of this guy. I'm starting them on prednisone. I want you to see them tomorrow. But instead of faxing a referral, this is it. This is the referral. And if my note is done by the time the referral is ready, it'll get faxed and attached by the clerk toward this referral to go to their office. How do clerks manage referrals? They manage them through the referral management system, except for PARC. I am so sorry, but we will fix that in post-production. These are your 3 most important tip sheets. The one for PARC, the one for ORHTO, and the one for GIMRAC. The one for plastics will follow, but it'll be very similar to ORHTO. You're just picking ORHTO clinics instead of plastics clinics. Now, let's demo ordering consults, PARCs, PCCs, EPACs, and referrals for doctors, for prescribers. Hey guys, so let's do some demos. First, let's start with a consult. I am now in Quick Orders view. It's probably the best place to order consults. You can also do them from the tracker. You can do them from anywhere you can reach orders. You can search for a consult. However, what I recommend, since we've done the work for you already, is to go to consults and only use searching for consult if you can't find this here. So from here, let's say I'm going to consult general internal medicine. There we go. Now it's here. Always modify, never sign. Take a look at what I have. Great. Stat, maybe urgent. CNSS. Special instructions. If, for example, I've already called the consultant and I don't want, I've already called, please do not call, and that will tell the clerk that they don't need to call. Consulting physician, you do not have to place a consulting physician in the order. The clerk can call whoever's on call. However, what it does if you do that is it immediately attaches the patient to that consultant's list. So it makes your life and their life much easier. They can immediately find it in their list when they're using their list, and you don't have to spell a complex name because it's already been there. So I'm going to take Jensen, for example, and there she is. I'm going to sign, and I'm done. Now this consult is gone for execution to the clerk's workflow. Next thing, let's order a PARC or a PCC. Now, PARC is usually what we do. PCC is chronic conditions, so I'm not going to demo that today. We don't use it as much. You can go from anywhere you can search for orders. Let's stay here and search from here. Let's see ED PARC. And I can see here, there's an order set for ED PARC. And what it does, it pre-populates everything and creates a communication order. So I'm going to click it, open it. Always modify, never sign, and let's see what we have. So I'm going for PARC. So what I need is I need a communication order. So to ensure the child is appointment prior to discharge, I am going to refer to PARC. I'm going to initiate now and now. Let me open the refer to PARC. And let's see what's there. It is the St. Catherine's PARC. It's for a future visit, of course. Peds acute referral. I can change the priority, urgent, and I can put in any special instructions I want. Orders for signature, sign, and the order is done. Now let's demo ordering an EPAC. I'm going to search this time from a different spot. Let's go. Let's say I'm in the patient's chart. I'm in the ED workflow. So I'm going to look for EPAC. And you will see EPAC referral. I'm going to open that, put it here, my box. Modify, never sign, and here is all the orders, including the ultrasound. So you can say now same day or next day. So we're going to choose next day because we don't want to do it and send them now. Weight, height, vital signs, a few communication orders, and that's it. Is it a routine? No, it's urgent. And you've got this inserted already for you. Okay. Orders for signature and sign. Let's talk about referrals. Referrals are an order, just like any order, so you can search for them for wherever you are. Remember, these are not consults. Referrals is when you're sending them for an outpatient care. And we said there are several types, so let's try a few. Here we go. I'm going to look for referral. That's the referral order. Now, if you remember when we were in the ED patient view, actually, if you are here, a referral order is already set up in your favorites. So you can click that. Box, modify, never sign, and this is where all the magic happens. They're essentially all the same. You pick a service the closest you can. I love that we have dermatology as a service. That is very interesting, maybe in the 22nd century. Let's say I'm referring to general internal medicine, right? The reason for the referral is cellulitis. And I've already started on Keflex and Doxy. Is it urgent? Yes. If it wasn't urgent, we shouldn't be doing it from the emergency department. Referral type, don't worry about that. Refer to, now here is the important part. You're going to search to whom you're referring to. And there are two ways of searching. You either search for providers or you can search for a practice. So if I'm referring to a specific internist to their office, let's say I'm searching for Dr. Chan. And this is what will happen in Niagara Falls because there is no GIMRAC. And then what I can do here is Terry Chan, and this is his office. And if I click that and accept it, this is now going to go to Terry Chan. However, let me remove that. If I am in St. Catherine's and referring to GIMRAC, if I search for GIMRAC, let's see what happens if I search under provider. Nothing comes up. However, if I search under practice, there it is, general internal medicine. And we're going to accept it. Currently, there's no distinction in the system between Welland and St. Catharines. You can put that in the notes. However, the clerk would know from where it generated from. So if it came from St. Catharines, then it's going to St. Catharines GIMRAC. And now all I do is sign, and that referral is gone. Let's do a couple of other referrals. Let's say I am referring to the fracture clinic. Now, fracture clinic is a little bit different because fracture clinics, as well as GIMRAC and St. Catharines, will be booked right from the referrals, right from referral management. The clerk will book it and give the appointment. Missing, I'm going to go with ORHTO. Reason for referral, ankle fracture. Treatment so far, splinted, analgesia, crutches. Is it urgent? Yes. Now, refer to, here we go. I know that this is already a practice, so I'm going to search here. I'm going to search for ORHTO. And let's say I am today, here we go, Niagara Falls, St. Catharines, or Welland. Let's say I'm in St. Catharines today, so I'm going to pick that. I'm going to accept it. I'm going to say I want this patient seen within 3 days. I'm going to leave any instructions for the staff if I want to. These go to our clerk. Okay. For example, book and inform the patient. Not that they need to be told. They know that already. And now sign it, and we're done. Now let's make a referral to an outpatient clinic in the hospital, and then we'll do one for a private practice. Referral, open, modify, never sign, 2 missings. Now, let's say urology, and I am going to refer to Dion. She has 5 practices, so I'm going to pick her private practice. Accept that. Reason for referral, 5mm stone, pain settled, no infection. Treatment to date, Flomax plus morphine, okay, plus CT. It's urgent. I've got urology. I want them seen within, say, 3 weeks from today. I don't have any special instructions. Sign it and send it. Now it's gone to referral management, and the clerk will transmit that to their office, and it'll show up in the printout for the patient as a follow-up, who they're supposed to follow up with. Let's do a referral to a clinic in the hospital. Say we want to refer a patient to thrombosis. Same thing. Now, thrombosis is not a service. We have dermatology, but not hematology. Go figure. The closest thing is probably medical oncology. Reason for referral, PE with a PESI of 55, so they can be managed not patient. Started on apixaban. It is urgent. Now, referral type. I know that I'm sending to a clinic, not a provider, so I'm going to practice. I'm going to say thrombo and search. And here we go. This is private clinic, and this is the one in St. Catharines. This is what I want. And if you want to take a look, there are 5 providers you can pick, but we generally don't care, whoever can see them first, right? So there we go. Again, blue, accept, right? I can write things like prefer Dr. Leonard, because I spoke to him, but first MD available. Okay, or I could say discussed with Dr. Leonard and first MD available. Let me see. I want them seen. I've given them a 3-week supply, so they can be seen within about 3 weeks or 4 weeks. And there you go. Sign, and it's gone to referral management for the clerk to process. Next, docs, stop. Get off the demos. The following is above your pay grade. It's none of your business. This is just for clerks from here on. So, referral management for health unit clerks. So here is what you need to do. Make sure you have the tip sheet in front of you, printed or on your screen, as you watch this video, and follow how Leslie orders all of these. These are the barcodes for PARC, for ORHTO, and for GIMRAC. And as I said, there's a couple more coming. Plastics will be very similar to ORHTO, and there's something for the HIU as well. Let's start with PARC and how to book a PARC appointment. It is different than everything else because it's a workaround. It's only hopefully a temporary solution. We'll fix this as soon as we can, but it doesn't look like any other referral, so bear with us. Here we go.
So from our point, once we've been told that we would go to the scheduling appointment book, we're going to go to this request list inquiry. From here, we're going to pick the request by queue, and we're going to pick the pediatric future book, and we're going to click the button find. We can drag this bigger, and we can see that this order has been placed for Robert.
Okay.
I need to book that appointment. So I've been told that this child is ready to leave, but they need an appointment at the PARC clinic. So I'm going to click on this patient's name. I'm going to right click and go down to complete request. I'm going to click the left click on the complete request button. I'm going to say the reason for my referral. So ED referral. And I'm going to say the attending physician. So I can type in who the attending physician was. I can click the search button. I will pick the attending physician, and I'm going to click OK. And that's going to populate onto my work in progress sheet. And I can see that this child is ready to be scheduled. I can click the suggest button, and it's going and fix my suggest criteria. So I want an appointment for Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, or Sunday, because it is a 7-day-a-week clinic. And I'm going to click suggest. It is going to give me the next available appointment. Double click that appointment, and you can see there's a check mark beside it. I click OK. I can double check that I've got the right. So this is booking me into the first available appointment for Robert Ross. I can click confirm. It will give me a confirmation sheet. I print my confirmation sheet, and then I give this confirmation sheet to the family for them to leave the ED, knowing that they are to come back on November the 4th, which is tomorrow at 12 p.m. for an appointment in the pediatric acute referral clinic. So if I click OK, I can see that this child had a pre-admit encounter for the ED and then an inpatient encounter. Here, I want to add an encounter because I need to add an outpatient encounter on to for this to be booked to. I have to click through and complete all of the required fields. So it's going to ask me for the encounter. It's going to give me a pre-registration encounter type. And it's going to give me pediatrics. And my visit type will be a face-to-face. And it will be in the clinic. It's going to ask me for an attending provider. Okay, and it is completed now. And we know it's completed because it's populated, it's finished. So if I were to go back and look, if I were to click into this chart and I go up here, I can see here's my pre-registration encounter for the pediatrics and the reason for the referral. So this is my outpatient clinic, and this is the referral to the PARC clinic. So when this child comes and registers, the pediatric ward clerk will change this to a outpatient encounter and check them into the clinic.
Now let's talk about the stages of referral management. When an order for referral is placed and it goes to your referral management, these are the things that you are going to do. The first thing you're going to do is you're going to find that referral. And to find that referral, you need to create and maintain your lists so you can find the different referrals easily. The next thing you're going to do is you're going to check the referral. Who is it from? Where is it to? Is it missing a location? Is it missing a clinic? Is there something wrong? Was it referred to the wrong place, like a Niagara Falls Emergency Department referred to St. Catherine's Fracture Clinic by mistake, and you're going to correct those. Then you're going to attach any documents that are present in the patient's chart, all from within referral management, to this referral, so you can call them out. Now you can start managing the referral or sending it. To send the referral, there are 3 stages. First, you have to start it. Second, you have to generate it. And third, you have to send it. And each one of these has some steps. You start the referral, you generate the referral, and you send it out. When you send it out, it goes to 2 kinds of people. The first is it goes to outside clinic. And the way it goes to outside clinics is by creating a letter or a package of a covering letter, information, documents that either get sent from the back end through the system, or if the clinic is not in the back end, printed and faxed it the old-fashioned way. However, there are a lot of clinics we send to are inside the hospital. And these clinics inside the hospital use referral management to do 2 things to the referral after it gets to them. When you send it, they accept it, and then they schedule it. Now, these are 2 things that are done within referral management. So when you send a referral to thrombosis, somebody in the clinic will accept it, and then will schedule it. The trick is this now. For orthopedics, GIMRAC, and plastics, either day 1 or soon, you are going to be doing that. So after you've started, generated, and sent the referral, you're going to go accept it and schedule it for these 3 types of clinics. Okay, so let's start with referrals.
So I'm going to go into referral management. And I can see that I have an ED originating referral list set up. Mm-hmm. And if I refresh my screen, so I'm in the referral management. So right here, there's the referral management. Click referral management. It will open my list. I will see my referral here, and I can see that it has not been referred to anywhere. So I need to change that referral. So I'm going to click in the blue space around this baby. I'm going to click the edit button. I'm going to click refer to provider and the magnifying glass. In the search by field, I'm going to change from provider to practice because we are referring to the pediatric consultation clinic. We are not referring to a specific provider. I'm going to search, and here is my pediatric clinics. So I'm going to click on that clinic. It will turn blue. I will click accept. I can now see that my referred to location is the pediatric clinics, and I can save that referral. I'm going to click start referral. I can confirm that all of my details are correct. So it's the reason for referral has been put here. The location where the referral is coming from. The referred to location is the Children's Pediatric Clinics at St. Catherine's site. The date the referral was written and the date service requested start date. And then all of that information is there. The other thing I have the ability to do is I have the ability in the documents section that if I wanted to add my ED note to that, I would be able to, my notes for this child would populate here, and I would be able to find my ED summary note that was written by the doctor, and I would click add, and that will automatically add and call out that I want the doctor when they're triaging, the pediatrician, when they're triaging this referral, that they would, I want to call out that note for them. Otherwise, they have the ability, like everywhere, they would see all of the notes in the chart. And then I can click generate, and then I can click send. This will send this referral now is pending acceptance. It will now go to the pediatrician in the children's unit to be able to triage that referral. And then the pediatric clinic ward clerk will schedule the appointment and call the family and let them know when the appointment is. Okay, so this referral is set to go to Dr. Kotrek in the community at the Cardiology Associates of Niagara office. Again, I can review all of my information. If I wanted to call out a service by date, I could do that. Right now, this referral is set as a standard priority with no suggestion of a service by date. So we can edit, and I could go service by date.
Mm-hmm.
And I could click here and I could say, I would like this patient seen by, November 29th. And I can attach a document, consult note. I could add that one. If I wanted to add the ED triage note, I could add that. So I could add any note I wanted to add from here. I could add the goals of care note. I'm going to click start referral. I'm going to click generate. And I'm going to click send. Because this is an external referral, it's going to populate a letter for me. And this is my recipient who I'm asking to send this to. I've attached 3 documents to this letter so I can see that my documents are attached. And I've got my referral service. So now I could go in and add the content. Also add results if I wanted to add results from the ED. So if there was any results that I wanted to call out in my referral, I can click add results and it takes me to the results screen and I could add a particular result. If I had an X-ray or an ECG or anything that I wanted to call out, I could call that out and I could add that. So I can see here like my ED physician note. Again, I could call that out. There's no results for my ECG, but if there was results, I would be able to call out and add my ECG note. I can preview my letter prior to. So I can see that this is the doctor that I'm referring to, the date of the visit. It's actually pre-populating, and I didn't realize that, so I can take out my doc, but it's pre-populating directly to that doctor, and it's because it's the emergency room ward clerk. It will say their credentials here, but it's calling out referred from provider. So all of that information, it's just the ward clerk is populating this letter, and then here's the documents that have been attached to the letter, so you can see the documents that were attached and you can review all of that. Once you've pre-populated, once you've done that, again, I could take this out. I'm just going to send this one and we'll. Okay, so then it's gone. So because it's electronically faxing from that. That I might suggest by adding a work list and calling it SCS ORHTO Referrals, because these ones are slightly different. So, and we need to set up a centralized list. And from there, we need to pick our refer from location. So we're going to, because this is St. Catharines, we're going to pick the St. Catharines ED right here, St. Catharines ED, and we're going to add that as our refer from location, and our refer to location is going to be the St. Catharines Orthopedic Clinic. So we're going to put that there. I also want to filter my list by orthopedic surgery because that's the service that it's going to be. And I'm also going to filter my list by status so that my list does not get unruly, because things never drop off your list. So once it's been done, then we can, so I only want to see things that are prep for send, once they've been accepted and once they've been scheduled, I don't want to see that. So I want to set my priority for my list. And I'm going to make this my default list for the moment, and I'm going to save it. I'm also going to do one for the Welland, Niagara Falls, ORHTO, Clinic, Referrals, or we're going to click the Niagara Falls ED, and we're going to click the Welland ED and add. We can include the UCCs as well. So when you click on it, it will open up everything. So we're going to unclick them. So again, when I open it, everything is blue. I just click on the site name and that will unclick everything, because if I don't, it will add everything to my location. So I now have my Niagara Falls, Fort Erie, St. Catharines, Fort Erie, Niagara Falls, Port Colborne, and Welland. And I can add that to my name. And FE/PC, ORHTO referral clinics. And again, I want to click on my treatment function, and I want to click orthopedic because that'll be the service, and that is a required field, so they cannot save. So all of my referrals for orthopedic will filter to this list. Mm-hmm. Again, I can click my status, so I can started, prep for send, sent, pending acceptance and accepted. I'm going to save. So I have my lists now, and I'm going to close this down. Now, if I go here to my St. Catharines list of ortho referrals, and I refresh my screen, I can see my referrals here that have been either accepted, not started, or pending acceptance based on my refer to location, but based on my service request. So here's where I picked orthopedic surgery. So all of my orthopedic referrals will come to this list. I can see that, again, I could filter them by requested date so that I can see, which ones are there. And I can see that this referral has not been started. Here, I can see that this referral has not been started here. So I'm going to click this referral. Because this is a centralized referral, I can see that this has been referred to the St. Catharines location. And I want to, and this has been referred from the Port Colborne UCC site. So this one here says it was referred from Port Colborne, and it's referred to the St. Catharines site. Port Colborne would not refer to St. Catharines. They would refer to the South Niagara site, so Welland or Niagara Falls. So I would click here, and I need to edit my location. So the word clerk would edit the location, again, by clicking practice, and click ortho, click search, and they can change to whichever site. So if the next appointment should be to Niagara Falls, you would click Niagara Falls. If the next appointment based on the clinical rotation should be St. Catharines or Welland, you would pick Welland. So we'll say it's Niagara Falls. I accept. I've now changed my location here, and I fixed the fact that it was referred to St. Catharines and it should not have been referred to St. Catharines. I can save. Okay. I can see that this has been accepted. And I'm going to schedule this appointment right from here. So I can click new appointment. I'm going to click appointment, my appointment location. This is going to the Niagara Falls ORHTO, and my appointment type. It's always going to be an ortho ED consult coming from the ED. Never any other type of appointment. This is the only appointment type we can have. I'm going to click OK. It's going to ask me the reason for the referral. And I think Hannah had a broken leg. And my attending physician, again, would be a physician that saw them in the ED. And once I've completed that, I'm going to click move. Again, my patient is being moved over to my work in progress. I'm going to click suggest. It's going to bring me to this suggested field. And I can see that I want to suggest appointments for the Niagara Falls Ortho Clinic for the ED consults, and I want it to be Monday through Friday. And I'm going to click suggest. I can see that this is the first available appointment. And if I click next, it will allow me to find the next appointments. So if Dr. Bristow is the next physician on my schedule, then I could click on here. I can double click. It will allow me, it will give me this check mark. It will say that I am scheduling this patient into Dr. Bristow's clinic on November the 4th at 12 p.m. because that is the next appointment, available ED appointment. I can see that they come in every 15-minute interval. If the next physician was, if I wanted a different physician, I could unclick Monday because say I had already scheduled to Dr. Bristow and I need to schedule to the next Niagara Falls physician, I could unclick Monday and I could click Tuesday, knowing the rotation of the schedule. But we'll leave it click to this first appointment with Dr. Bristow. We're going to click OK. I can open up my resource and I can see that this patient has been scheduled to Dr. Bristow. And here's my piece. I'm going to confirm my appointment. I'm going to click, I can print off my appointment and give that to the patient so they will leave the ED with the appointment confirmation. I'm going to click OK. And it has scheduled that patient into Niagara Falls. Okay. And I can see they've now dropped off my list because when I filtered my list, I don't want to see scheduled appointments because my list will be too big. So here we are in our ortho referrals. Wonderful. Here's our patient that's been referred to orthopedic. You can see that they have no referred to location, but they've been referred to the orthopedic surgery. So I'm going to click on that patient. Before I can start anything, I need to select a refer to location. Because this is coming from the St. Catharines ED, it's going to go to the St. Catharines Orthopedic Clinic. I'm going to change it to practice. I'm going to take ortho, click search. I can see my St. Catharines Orthopedic Clinic. I'm going to highlight it, accept it. I'm going to save. Okay. I can see that it's saying I need an orthopedic referral. This is my date of request, and that I need this patient to be seen by the 7th of November. I'm going to start my referral. I'm going to generate my referral. I'm going to send my referral, accept, click pre-registered to St. Catharines Ortho, submit. I can see that this patient has a plastics referral for this date, but I'm going to click new appointment. I'm going to click appointment and my location in Catherine's Ortho. I'm going to pick my ED consult, only ever ED consult, because this is coming directly from the ED. My reason for exam, my attending physician. I'm going to move it over. I'm going to click suggest. I'm going to click suggest. It's going to give me the first available appointment. So I'm going to take that first available appointment because that's how St. Catharines books, to the first available appointment. Click OK. And I click confirm. I get my confirmation so that I can print this and give it to the patient to leave the ED with their booking. I click OK. And the patient is booked into the clinic. One sec. Let's just take a look. And the refer to location is, oh, here's my plastics clinic ad. And I'm going to, my treatment function is going to be class. So I've got my save, close, and I'm going to refresh my screen. And if you've done a plastics order for me,
I haven't yet. I'm doing it right now.
yeah, as soon as you do it, it will populate on my list here. Fresh. So if you've refreshed there it is right there. So here's my referral for plastics now. Again, it's not started. I'm going to click on this referral. I can see my referral here. I need to review my referral, make sure. So it's being referred to the plastics clinic in St. Catharines. Okay, it's not started. I'm going to click start referral. I'm going to click generate. I'm going to click send. I'm going to click accept. Oh, see, that other one didn't do this. There must have been something already pre-done to it that I didn't realize. I'm going to, once I click accept, it's telling me my location is plastics and it's a pre-registration. I need to click pre-reg as because I need to create an encounter. I'm going to click submit. I'm then going to go to scheduling. I'm going to click new appointment. I'm going to, again, go to my appointment location. So I'm going to go SC plastics and I'm going to search. And my appointment type, again, is going to be a plastics ED consult, always only an ED consult. My reason for exam, hand fracture, my attending physician. I'm going to click my attending. I'm going to move it over. I can then click suggest. Again, I've got here, so I want the first available appointment. I'm going to click suggest. Oh, slots available for specified time. Yeah, it's only giving me the Sunday clinic. Also click, so it's giving me the Sunday clinic appointments. I'm going to double click on this and I'm going to click OK. It's put that patient into that Sunday clinic. So the next Sunday clinic, I'm going to click confirm. I'm going to click OK. And the patient is booked into that Sunday clinic. I need to make a list because it's a centralized booking as well. So I need to make a GIMRAC list. So I'm going to do St. Catharines, ED, GIMRAC, referrals. I need a centralized list. I need my maintenance. So my refer from location, again, is the St. Catharines ED. Add my refer to location is the GIMRAC clinic. And my treatment function would be general internal medicine. So that would be the drop-down choice that you would pick for GIMRAC. And I can save it. Go ahead and place that GIMRAC order. Click on the GIMRAC referral list. I can see patients that have been referred to the service of general internal medicine, which should in turn refer them to the GIMRAC clinic. So this is the referral that was just placed. You can see that it's not been started. You can also see that these patients have been scheduled, and you can actually see that this patient has been seen. So if I don't want to see those because my list will get massive, I can filter those off of my list. So I click list maintenance. I click my GIMRAC referral list. I click my status, and I only want to see my not started referrals, my prepped, my pending referrals, and I can save. Okay, it's going to drop those referrals off my list. So I need to go in. This referral has not been started. The patient needs to leave the ED with an appointment. I'm going to go in. I'm going to review that they've been referred to the GIMRAC clinic, general internal medicine, that it's an urgent within the next 72 hours from St. Catharines. I'm going to start my referral. I'm going to generate my referral. I'm going to send my referral, accept the referral, my referral tool location, St. Catharines GIMRAC. I'm going to pre-reg, select my create an
Can you show me if
encounter.
there's any other locations besides St. Catharines, GIMRAC?
Not from this
Oh,
drop down because
perfect.
my location has been
Yeah,
pre-selected.
got it. So this is only St. Catharines.
Correct. Okay. It's been accepted. I'm going to go into my scheduling, new appointment type, SC. Yeah, I need the mnemonic for it. That's it. Sorry. So again, my appointment type. So this is a consultation. I'm going to click OK. Reason for exam, chest pain. Okay. I'm going to move it over. Again, I'm going to click suggest. It's going to open up my field and I'm going to click suggest. It's going to give me the next available appointment. If I need something else, I can click next. If I need the next day, I could also click next day and it will give me the next day. I could click next day and it will give me the next day. So I'm going to take the first available appointment because I wanted this patient seen. I double click on the appointment. I click OK. I can open my plus signs and I can see that this patient has been scheduled to 11:10 on November the 4th. I can confirm that appointment. I can print off my appointment confirmation. I click OK. And the patient's booked into the GIMRAC clinic and I give them the appointment confirmation so that they can leave with that. If I refresh my screen and I go back to my GIMRAC list, I can see that that patient is gone because I filtered my status for those patients that are scheduled to drop off. Again, I can take that off of there. I can take all of my filters off if I want to. I could take all my filters off. If I take my filters off and I save and I click close and I go back and I can now see that that patient that I just booked has an appointment scheduled for November the 4th. If I click on this patient and I click the scheduling tab, I see that there's a 1 there and I can actually see this is the appointment that was booked for GIMRAC for that patient. So if they have other appointments booked, if they have x-rays or anything else booked at any other outpatient clinics within Niagara Health, they would show up here on appointments. Yeah, click there. Marvelous. Can you click on list maintenance?
Okay. List maintenance.
Yeah. And can you open that list? Open the ED. Yeah.
Default list, yeah.
Yeah. And can you click refer from location?
Mm-hmm.
So these are all referrals that are being referred from the St. Catharines ED that will show
Because my
up.
location is St. Catharines ED, that's why.
Yeah, perfect. So that's click. So then go to your status again. And this is where we want to unselect. So anything that
So I'm
has.
going to do sent. Can I select more than one? Accepted? Yeah.
Yeah.
Or do you want accepted?
I think accepted is going to make your list very cluttered.
Okay, accepted. On hold.
Yeah.
Rejected. Scheduled.
We really want to remove all of those.
Yeah. Patient seen. Completed, closed, and canceled. Remove them.
Yep.
Oh, not started, pre-started, pending acceptance. Is that it?
Even leave pending acceptance for the moment, but yes, click save.
Mm-hmm.
And Click close. There we go.
That's much
That's
more
a much
manageable.
nicer filtered
This is
list.
medical oncology PE. So I'm going to try to schedule this. Okay, guide me through it. How about we do that?
Okay, so you're going to click in, and click in the blue box, not on the patient name, just the blue box. Yep. Perfect. Okay. So now you need to, this is being referred to the thrombosis clinic. Perfect. So you're going to click start referral.
I'm going to generate.
Now, if you wanted to click add any documents to it, you're going to click on the document button.
Documents. There you
and
go.
Then you can
There's only a triage. We'll add it.
Yeah. And then you're going to click generate. We actually are never going to schedule this because this is going to the thrombosis clinic for triage.
Generate.
So you're going to click generate. And you're going to click send. And you can close it. And just refresh beside the list maintenance, click your little refresh. And you can see now that that's sitting in a pending acceptance state. And that's where I don't even know, to be honest with you.
Maybe we should take out pending acceptance.
That you care, because
we don't care.
That means it's gone over to thrombosis, and they are
default.
going to now look.
Go to status. I'll take pending acceptance. I'm going to remove it.
Yeah.
There you go.
And click save.
Hit save.
Yeah.
There you go. Let me schedule this one to Dr. Marie Dion because this is going outside the organization. It's a little bit different.
Yeah. Okay.
Right. So I'm going to do this. Yeah. Now, let me see where I am. I'm going to take a look at my details. Renal colic is the cause. St. Catherine's, ED coming, going to Niagara Associates. This I have here. It is urgent. I don't have anything else. For documents, I'm going to pick the ED consult and add it.
Yeah.
I'm going to start my referral.
Correct.
Once I start my referral, that's it. I'm going to generate.
Yep.
And now that I am here, I'm going to send it.
Yep.
Now, because it's external, it should open a letter form for me. There you go.
Correct. Yes.
Okay. Please see and accept attached referral from Dr. Setrak. Great.
Yeah.
And you there's a referral, and then I'm going to do recipient is here already.
Yep.
Do I just?
You can add results if you go down the bottom and you can preview.
Oh, here it is. Preview.
Make sure it looks good.
There it is. With the note.
Correct.
Cancel that, and I'm going to hit OK.
Well, hold on one second. I want to tell you something else while you're here. Go up to the top there and see where the auto texts are. One more over. Manage auto text. Click on that. And that's your dot phrases. Yep.
So you can create something and you can
You
can save it here. Okay.
Correct. So you could create a preset, like the ward clerks could have a preset dot phrase.
Let's create the dot phrase here.
Yep. You're going to click add. See the plus sign?
Add.
And abbreviation for it.
Accept. Okay. Or
Yep. Doc accept ED referral, whatever you want to call it. Yep.
Put that here. Okay. And save. And then what I could do here is now that I've done this. I can say dot accept.
Yep.
There you go.
Yep.
And now done. Okay.
Yeah. Again, click preview because it'll show you your thing with your so there.
Now, because this is blue, this is in the background. It's already set. I don't need to do anything because it's blue.
You don't. Yeah. When you click OK,
it looks like it's going to print it to a printer instead of a fax.
It should automatically print. It's set to automatically.
Maybe I don't have it set up. Are the clerks going to have it set up, or
they should have it set up? Yes.
I'm just going to send it to my printer.
Yeah.
Now here I am.
So, see your screen there. See right in your document section. Your letter is actually been saved as a document.
Oh yeah, here it is. There you go. Yeah, there it is.
Yeah.
Oh yeah, here it is.
Yeah, there it is.
If you have any questions, you know how to get a hold of me. Otherwise, thank you very much for your time.